On March 14, 1898, a clerk in a London newspaper office stared in disbelief at the photograph of a match factory worker whose jaw seemed to glow like a dying ember. The bone tissue rotted away in a blackened maw, an image that would become the gruesome hallmark of the Phossy Jaw epidemic. At the turn of the 20th century, the humble match was a household miracle, lighting homes, factories, and streets with a single strike. The secret of that quick, reliable flame lay in white phosphorus, a soft, waxy element that ignited at a low temperature. To keep costs down, British manufacturers mixed the toxic metal into the head of each match, exposing countless workers, predominantly young women and boys, to a silent, invisible poison day after day. What began as occasional soreness soon manifested as an excruciating, progressive disease. Workers complained of dull throbbing in the jaw, swelling of the gums, and a foul taste that lingered like ash. Within months the pain intensified, the skin over the jaw turned a sickly gray, and a foul odor seeped from the mouth. As the bone tissue died, it turned brittle, cracked, and in advanced cases fell away, leaving a cavernous, necrotic hole that emitted a faint, phosphorescent glow under the dim gaslight of the factory floor. By the mid-1890s, hospitals in Sheffield, Liverpool, and London were receiving an alarming influx of patients with identical symptoms. Physicians noted a striking pattern. The afflicted were all employed in the strike-anywhere match houses, and the disease spared no one who handled the phosphorus-laden matches for more than a few years. The condition was later termed Phossy Jaw, a grim abbreviation of phosphorus necrosis of the jaw, and it spread like a silent plague through the tightly packed workrooms where men, women, and children hunched over vats of molten phosphorus for 12-hour shifts. Medical pioneers such as Dr. John Croft, a surgeon at the Royal Infirmary of Edinburgh, began to document the disease meticulously. In his 1896 paper, Croft described the characteristic florid, ulcerated lesions and the presence of a soft, cheese-like necrosis that oozed a faintly luminescent fluid when exposed to light. Autopsies revealed that the phosphorus had infiltrated the vascular supply of the mandible, causing rapid bone death, and a secondary bacterial infection that spread to the lungs in many victims. Public health officials could no longer ignore the mounting evidence. In 1897, the British Ministry of Health convened a royal commission to investigate the hazardous conditions in match factories. Witnesses testified that the factories offered no ventilation, that workers were forced to inhale phosphorus dust for weeks on end, and that management dismissed complaints as mere imagination. The Commission's report warned that continued exposure would lead to a nationwide scourge of jaw disease, crippling labor and shortening lives. The ensuing legal battle became the first major occupational safety trial in Britain. In 1898, the Match Workers' Union, spearheaded by the charismatic labor activist Ellen Mayhew, sued the largest match manufacturer, Bryant & Co., accusing the company of negligence and willful endangerment. The courtroom was packed with journalists, factory workers, and curious onlookers, all eager to hear whether the law would finally hold industrialists accountable for the suffering of their labor force. During the trial, expert witnesses presented stark evidence. Dr. William Hargreaves, a pathologist from Manchester, displayed a fresh specimen of a jaw that had been removed from a 22-year-old worker who had died of sepsis. Under the harsh fluorescent lights, the bone glowed a sickly green, the necrotic tissue sloughing off as if the jaw itself were melting. Hargreaves explained, "White phosphorus is a lipid-soluble poison. It penetrates the periosteum, destroys the blood vessels, and precipitates a rapid, irreversible necrosis." The defense countered with the claim that the disease could be caused by poor dental hygiene or tuberculosis, but the correlation with phosphorus exposure was too compelling to dismiss. When the verdict was finally read, the judge ordered Bryant & Co. to cease the use of white phosphorus in match production, to pay substantial damages to the families of the victims, and to fund a medical research fund dedicated to occupational diseases. The ruling sent shockwaves through the industrial world, marking a turning point in the fight for workers' rights and safety. Autopsies performed after the trial revealed a chilling consistency. The phosphorus had formed microscopic crystals that lodged within the bone matrix, igniting a cascade of inflammatory responses. Microscopic analysis showed that the necrotic bone was surrounded by an army of white blood cells, and that the surrounding soft tissue was riddled with micro-abscesses that released a distinctive phosphorescent fluid when exposed to ultraviolet light. These findings not only confirmed the causal link, but also laid the groundwork for modern toxicology, illustrating how a single element could infiltrate the body and wreak havoc at a cellular level. Public outrage surged after the verdict. Newspapers ran headlines like, "The Burning Jaw of Industry and Matchmaker's Poisonous Secret Exposed." Parliament convened an emergency session, and within a year the White Phosphorus Match Manufacture Act of 1900 was passed, banning the use of the element in all British match factories. The law mandated strict ventilation standards, regular medical examinations for workers, and the substitution of safer red phosphorus, a less volatile, non-necrotizing alternative. The impact of the Phossy Jaw epidemic rippled far beyond the match industry. Subscribe to the Autopsy Files for more stories like this.